Hello, and welcome to Season 2, Episode 4 of the Home Health Care Today show. I am your host, Dr. Celina Gorre. It's February, and in February, we spend some focused time and attention on a couple of our episodes centered around American Heart Month. On this particular episode, we have the distinguished opportunity to chat with Miss Celina Gorre. Selena is the Chief Executive Officer of WomenHeart. WomenHeart is the national coalition for women with heart disease. Selena, prior to assuming the role of CEO at WomenHeart in Washington, D.C. in 2019, she brought 20 years of experience in global health, corporate social responsibility, and research funding to the organization. Prior to joining Women Health, Selena served as executive director of the Global Alliance for Chronic Diseases. In that role, she led the secretariat team based in London. Previously, she was the managing director of the Foundation for the United Nations Global Compact, where she headed up the private sector funding team and led the overall development and management of the New York-based nonprofit. She's also worked in the field with the United Nations Population Fund and UNICEF in Angola as a senior HIV and AIDS advisor. She consulted the government of Angola on its HIV strategy, child survival and nutrition programs in local communities on their social and community investments. Selena has extensive experience developing health and social programs for multinational corporations, some of which include Nike, Volkswagen, Colgate, American Express, and Chevron. She assisted and consulted these organizations on their strategy implementation for employees, consumers, and in communities. Selena holds a master's degree in public health and epidemiology, a bachelor's degree in psychology, both from UCLA, and she also has a master's in public health administration from Harvard University. Celina Gorre, welcome to our show today.
Thank you so much for having me.
Yes, Selena, we want to dive right into the topic, of course, of heart health and American Heart Month and learn more about WomenHeart.org. But before we jump right into WomenHeart.org, tell us a little bit about you. You know, your passion for women, your passion for heart health, and what brought you to WomenHeart as CEO?
Thank you so much for the question and for the generous introduction.
Yes.
So I came to WomenHeart about 2.5 years ago after having spent over 8 years funding research around the world on issues like hypertension and diabetes. And through that work, I learned that heart disease was the #1 killer of women in the majority of countries, including the US.
Yes.
And so when WomenHeart came calling, I thought, what a perfect opportunity to have an impact on the lives of women in this country.
Yes.
And so packed up my bags from London and moved straight to Washington, D.C., where I've lived ever since. And it's been, you know, a continuous and daily inspiration to get to work with champions, which is what we call our volunteers. And these are women who have survived heart attacks or had another kind of heart diagnosis and have decided that they needed to help other women who are going through similar circumstances, so that their heart journeys are a little less traumatic and a little less lonely.
Absolutely, absolutely, Selena. So some very serious work that does, require the attention, right? The attention of healthcare facilities and agencies, and of course, national organizations such as Women Heart to support. So going back to Women Heart, like if you could put that mission of the organization in a statement, what would the mission be? Tell us a little bit about the history, some of the milestones for Women Heart organization.
Sure. So, I think what's important to know about Women Heart is that we are an organization that is patient-centered. And
Yes,
that is really, really important to stress. We are an organization that advocates, educates, and supports women with heart disease, but
yes,
also an organization that lifts up the voice of the patient. Um,
yes.
and so, with that background in mind, the mission of the organization is to improve the lives of women living with or at risk of heart disease while fighting for equity in heart health. And so
Wow.
this health equity part is really, really critical because not every group across this country is impacted by heart disease in the same way. And
Certainly.
certain groups that are disproportionately impacted, let's say, by heart disease. And so Women Heart wants to make sure we are doing what we can to address some of those inequities.
Absolutely. Yes. Yes, Selena. So there is, of course, the health disparities across, various racial and ethnic groups. There's socioeconomic divides, oftentimes with healthcare and outcomes. And as we take that as a lead, please provide an example or some examples of how Women Heart has been able to realize that mission and have an impact on those stakeholder groups.
Yeah, it's a great question and a timely for us because I think it was last year we trained our 1,000th champion.
Wow.
Um, Training is quite rigorous. I have to say. Once they make it successfully through our rigorous recruitment process, we send them to the Mayo Clinic in Rochester, Minnesota, and that's where they get their training from the head of the Women's Heart Center there.
Wow.
Uh, so it's not a trivial matter of getting trained up. Of course, in 2020, when we had the pandemic, that was the first class to have that training done by the Mayo team virtually. Uh,
Yes.
but in any case, we now have a number of champions spread out across this country, women who are just as passionate, if not more, than I am to help other women through their process. And as we already, I think, talked about before the show, there are some right there in your part of the country
Yes.
ready and willing to support women living with heart disease.
Absolutely. Absolutely, Selena. I am so glad to hear that the training did go virtual, right? And you all were still able to maintain that active core of trainees and maintaining the rigor even during the pandemic. Okay,
Absolutely.
so that was obviously a challenge, going virtual and still keeping the attention on heart health and the organization in view of so much focus being on the virus. So that leads to this question. What are some more of those challenges, Selena, that the organization has? And then maybe, prior to the end of our interview, we could talk about ways that other organizations and individuals can be of assistance in helping Women Heart to meet some of those challenges.
Absolutely. So I'm a person that tends to look at the glass half full.
Yes.
And the pandemic, I often say we would never wish it on ourselves. We would never want to go through the devastating experience that we've gone through collectively as a
Yes.
humanity, right? As a human
Yes.
race.
Mhm.
But I think there are many of us that can point to the pandemic having some silver linings.
Yes.
Our organization has benefited from a number of silver linings relative to the hardship that we've faced, as well as a small national nonprofit with a pretty large mission. So
Yes.
I think obviously one of the biggest challenges was, first of all, getting the word out that there are particular risk factors during this pandemic for people with heart disease.
Yes. Absolutely.
Or, they would be considered part of the high risk groups when we hear about requirements of mask wearing or prioritization in the early days of the vaccine, the prioritization of folks with a particular level of risk. Women with heart disease are definitely part of that group of folks with a risk, right?
Yes.
So what we were doing in the early days of the pandemic was a virtual webinar series where we were talking about the facts and figures, because if we could all recall back then,
Yes.
we were operating in a world of unknowns.
Totally.
We were working with cardiologists and other experts and scientists to help our community learn as we were gaining new information and gaining new knowledge.
Yes.
All the way through to when the vaccine was available, there were obviously some early questions about how safe the vaccine was for people living with heart disease.
Absolutely.
And we were sort of, I would say, kind of evolving as the science was evolving related to COVID.
Yes.
Wanting to always prioritize the health of women with heart disease, so
Absolutely.
that information that was accurate and based in science.
Yes.
Another big challenge that I think we were dealing with was misinformation.
Absolutely. Yes.
That was stoking up fears that then we had to make sure we were combating with important and real evidence that was based in data.
Absolutely, Selena. And I do appreciate the approach you took to answering that question in view of the challenges presented opportunities, where the organization was not only able to adapt, but I gleaned from that piece there that the organization adapted, it evolved, it integrated new knowledge as the knowledge became readily available, based in science, as well as being delicate in view of the fact that heart disease and some of its comorbidities were certainly exacerbated, right, by the virus, but not wanting to sound off more alarm bells than needed, but continued focus on how to provide more support. Yes, Selena. So when we think about success of some of the chapters, we're here in Metro Detroit. There's a chapter in Novi, Michigan. So we do want our listeners and viewers to be, of course, made aware of that. What are some success stories, Selena, that you would point to as related to any of the affiliates or even the national branch in view of efficacy?
So many success stories.
Yes.
I'll share with you two particular success stories of individual experiences.
Yes.
And one of our champions named Kathy shared this experience with me, where she said that one of the things that our champions do is they are present at various community health fairs to provide accurate and timely information. And we give out what we call our red bags of courage with,
yes.
Again, information specifically tailored to women, not just in terms of how to manage heart disease, but also how to prevent heart disease.
Yes.
And she had a woman come up to her and this woman said, one of those red bags saved my life.
Wow.
Sorry, red bag saved my neighbor's life. And she
Yes.
said, I brought this bag home. I didn't really, I read the information. I passed it on to my neighbor, and apparently her neighbor then, based on that experience, went and had her heart checked, and she was found to have a 99% blockage by her doctor. She had no symptoms prior.
Yes.
And so able to treat that before it inevitably would have led to a heart attack.
Yes. Yes.
Important story. Another story that I was able to witness personally. Another thing that our WomenHeart champions do is they do bedside visits. Prior to COVID, they were doing bedside visits.
Yes.
I had the honor of doing some rounds with another one of our champions, who also actually was named Kathy.
Yes.
We were in into a hospital room with a woman who was pre-op. She was waiting for a particular procedure, and she was inconsolable. She was afraid. She was anxious. She had her partner, her husband, with her, but he, couldn't offer much more than his hand to hold her hand.
Yes.
And Kathy was able to sit down with her and say to her, I was in exactly your position 10 years ago.
Yes.
That's the one sentence that turned it around for this woman, because this woman thought she was going to die.
Yes.
So the presence of our champions with women who are going through walking that path themselves is a life changer for so many women who are in a vulnerable position, who don't know how they're going to make it, and then to speak to someone who not only is living 10 years later, but is actually helping and well enough to help others 10 years later.
Yes.
Powerful. And I tear up every time I think about that story, because
absolutely
of what we do as an organization. So that is, those things continue to stick out in my mind. Yes,
those are two excellent examples. The intervention, the first example of the red bag, and a individual being able to get information to read, hey, these are the warning signs, I'm feeling this way, let me get to a doctor, and then to find out that there was 99% blockage. So that real-time intervention just by a person having the information in the palm of their hands. And then that second example is phenomenal as well. So we talk about support groups a lot of times, right? And we talk about communities of practice, and we often talk about them theoretically or in an abstract way. Rarely are we in the moment discussing, dispatching a champion or dispatching a guardian angel, to be able to speak to a person in their time of need, and then a decade after experiencing the same type of situation. So for that person that was in despair, I too can imagine that their mind might have shifted from, calamity and this is it, to wait a minute, this could be it in terms of me being here 10 years from now, helping someone out, as a champion.
Absolutely. And the way I would phrase that is, it went from, fear to hope in a matter of minutes. It was a powerful moment that, I'll never forget.
Very much so, very much so. Selena, we're gonna take a commercial break and come on back, and we have several more, engaging and interactive questions to ask you, about, of course, American Heart Month, WomenHeart, and then more about your background. So we'll be right back. Welcome back to season 2, episode 4 of the Home Health Care Today show. And for those of you that are just joining in, we are joined with Miss Celina Gorre. Selena is the CEO of WomenHeart. WomenHeart is a national organization based out of Washington, D.C. WomenHeart has chapters in about 34 states and 1,000 champions, volunteers strong. Okay, Selena, thank you for all of the insights in the first half of our interview. We have a few more questions. Okay, when it comes to physicians and specialists, there are patients and families that oftentimes have a little bit of angst about going to see a cardiologist. In your professional opinion or with professional advice, how would you suggest families go about communicating, seeking out, and interacting with cardiologists in their area?
This is a great question, and one that I think, we probably don't think about enough, because I think it's very easy to say, just see your cardiologist, without really understanding that there might be some real hurdles.
Yes.
Cardiologist, whether it is questions of access or questions of fear.
Yes.
And so I think one of the first things I would say is, if you have a good relationship with your primary care physician, that and have, and trust them, I would ask them for recommendations.
Yes.
Cardiologists are physicians like other specialists, and they all work together in harmony.
Yes. Mhm.
So if you trust your PCP, I would say get good recommendations from them.
Mhm.
And the second thing I would say is, we at WomenHeart have regular webinars. In fact, if you go to YouTube now, go to our YouTube channel now, you will see a number of webinars where you will get to meet cardiologists, and you will see that they're not all that scary.
Right.
They are there to help.
Yes.
And that they want, and I think this is really critical in the world of heart disease, that you want to look for a cardiologist who won't judge. I think so many times what the fear is about being judged.
Yes.
Because we blame ourselves.
Mhm.
I have high blood pressure because I don't exercise enough, or I don't sleep well, or
Yes.
and I think you want to take that off the table.
Yes.
If that is on the table, then that will just add more stress to what is already probably a stressed out heart.
Absolutely.
So this is really critical. So if you need to take some baby steps, watch some videos of cardiologists, and we've got some excellent ones in our videos.
Yes, this is good. Good advice. And you nailed it, Selena, with some of that guilt that a patient may have, or even a thought that the cardiologist is going to judge me. He or she may judge me based upon risk factors, right? Or heredity, right? Or my demographics and zip code, right? But to encourage patients to watch those videos, get information, and get an understanding that there are some things within our heredity and our DNA that are modifiable. So we have some modifiable risk factors that other champions and affiliates could help people work through and talk through, but seeking that sound advice and consultation and care from a licensed cardiologist is a great way to go. Okay, efficacy. I'm sorry, you got one? Uh-huh.
Yeah, I have to just interrupt you, because
Sure.
back to the example that I gave about that 99% blockage. That
Yes.
person had no symptoms. And so what's really key when we think about heart health and cardiology, right, is get checked. Because often
Yes.
people, I'm scared of heart disease or heart attacks because it's so sudden. I promise you that in the majority of cases, it is not sudden, it's just silent.
Yes.
For years and decades. So getting your heart checked is really, really critical.
Yes.
not having as many health surprises.
Absolutely.
To reinforce that as we're talking about seeking care from a cardiologist.
I'm glad that you did. I'm glad that you did, because there are some people that operate from that school of thought of, if there's something wrong, I don't want to know. Well, actually, you do want to know, right? You certainly want to know. Awareness, early detection is very, very important, right? And to the point about not having signs and symptoms, this is where, as an organization, a home healthcare agency, we try to match our patients who don't have a primary care physician with a visiting doctor, right? So we try to help people to move away from avoiding those yearly checkups, biannual checkups, and definitely seeking out specialists when need be. Okay, I'm having a good time with our conversation, Selena. When you think about efficacy now of WomenHeart and those 34 states that there's chapters and 1,000 champions, how would you, assess the efficacy of the agency at this point?
Yeah, it's a really good question. So we talk often about process indicators, process metrics. So simply, I call it head count. So how many people have we actually helped? I mentioned earlier that our champions are often at health fairs.
Yes.
Also running support groups. And so the Novi chapter that you talked about there in Michigan,
Yes.
that means that there is a support group there. So there is
Yes.
women who come together on a regular basis, monthly basis, actually, to
Yes.
talk about health and to support each other through that. And so one of the more important ways that we assess our efficacy is actually through really critical feedback from those women, from the users of our service, let's say, to determine exactly whether or not they are getting what they need from what we do and what we offer.
Yes.
One piece of, and that's on the quantitative side, but on the qualitative side, one piece of feedback that we as an organization have gotten, which again really has stuck with me through the years, is they said that this woman said, my cardiologist saved my heart, but WomenHeart saved my life.
Wow.
That's
Yes.
really impactful. So on the one hand, we obviously want to be collecting hard metrics in terms of satisfaction and quality relative to the services that are being rendered, but we also really equally need the critical qualitative data like that piece of feedback, because oftentimes in our work, because I'm not seeing patients on a day-to-day basis, sometimes you lose touch of the meaning of it all and the purpose of it all. And so when somebody can say that to you and say, I don't know where I would be without WomenHeart saved my life.
Yes.
These things just spur me to continue on. Because some days, as you know,
Yep, sure do.
days this work, you just sort of want to give up, and try again the next day.
Yes.
So, it's really meaningful and touching when we hear those anecdotes of folks who really are changed by the experience of coming to one of our support groups.
Absolutely, Selena. So what I gathered from that is that from that anecdote, that testimonial, the cardiologist saved, my heart. So that physical improvement or that physical sustainability. But WomenHeart saved my life. So that social piece, that hope, being connected to a group that has the resources, has the experience, and has the insight to help me to continue to fight on. Because I think without that will to fight and without that support, some of those scientific and medical interventions don't have the same level of efficacy without the support systems and the will and the drive of the patient. So,
Absolutely. Absolutely. That's
yeah,
right. I would also just add that, it's the mental health component, right? I mean, that is what in large part we are doing, is providing that emotional and mental support, psychological support, for women who are going through a pretty traumatic time in their lives.
absolutely, absolutely. And that is invaluable, invaluable as well as remarkable, Selena. So congratulations on the great work that Women Heart is doing in that space. Uh, Earlier, we talked about bedside, prior to the pandemic, being able to send out champions to support individuals at their bedside. At American Advantage, we support homebound patients, right, who have those chronic illnesses that make them, in many cases, homebound and also bedbound. So in view of the homebound community, Selena, why should families, in your professional opinion, why should families as well as caregivers, survivors that may still have some health challenges, as related to their heart, why should they consider perhaps home health, in your professional opinion, as a means to assist and support them?
I want to sort of take a little bit of a different approach to the question. I think that so many of the patients that I have come across want more than anything continued independence. And for many people, that means staying home,
Yes.
continuing on to live in their homes. And so the way I think about what you just asked about home health care is about enabling that continued independence and that continued ability to be to live the life that they want to live.
Yes.
So this is both a professional but maybe even a personal opinion, that the ability to live that independent life will go a long way towards mental health strength.
Absolutely, absolutely. So I do really appreciate, Selena, the approach that you took to that, as focused on the goal of quality of life and independence, sustainability, survival and thrival, and then perhaps looking at home health care and other interventions as tools to support patients and families in achieving those goals.
And I think about WomenHeart in the same way,
Yes.
have mental and emotional and psychological support through what your physical experience, the difficulties you might be going through physically, then you're able to do more,
Absolutely.
better, and have better outcomes.
Yeah, so we're going to definitely take, leaflets and information, even perhaps go to our Novi chapter and get some of those red bags. But we're going to, at the very least, put a leaflet in our starter care packets and folders for the patients that we serve throughout Metro Detroit, so that they are aware that, yes, American Heart Association's, Detroit chapter and Ann Arbor chapter and Lansing chapter are here, but also Women Heart has a location in Novi to provide support to patients. So we're gonna spread the word, Selena. Selena, as we wrap up, I have two last questions. All right. So I said we're gonna spread the word. We're gonna do our part. But I want to ask you your need or your big ask, right? As you think about benefactors, because we talk a lot about beneficiaries of the work that Women Heart does, but some of those benefactors out there that may want to, be obviously a volunteer or start a new chapter, are there ways that benefactors could be of greater support? And if so, what will be your big ask to some of those benefactors out there?
Yeah, it's a really great question. I think one of our goals has been to be, I mentioned earlier that we are in 34 states. One of our goals is certainly to be in all 50 states, because
Yes,
that there are 16 states that are left with some unmet needs. And
yes,
that's one of the first things is, for all of you to visit womenheart.org, and to see if you know folks who are in those 16 states, because what we're going to be doing in the summer is recruiting our 2022 class of champions. So
wow,
if you know any woman who has survived a heart attack or has a heart disease diagnosis, and is ready and willing and needs to help others, we are the organization for them. Um,
wonderful.
so that information can be found on our website, womenheart.org. But I think there's a bigger, I think, aim for those who may not have heart disease, or who want to do something else, which is really encourage anybody in your sphere of influence to get checked, to get information. And again, coming to our website, womenheart.org, is a great place to start. I will also say that not only is February Heart Month, it is also Black History Month.
Yes,
As
it is.
and WomenHeart, for February, has launched our 29 Days of Heart campaign, which is focusing on Black women's heart health.
Yeah.
So another big ask is to follow us on all of our social media platforms, on Facebook and Instagram and Twitter and LinkedIn, to hear some amazing stories of resilience and triumph and thrivership in the face of heart disease, of Black women who are not only dealing with their own health issues, but are
Yes.
also dealing with some challenges in a healthcare system that is sometimes much more challenging for Black women than perhaps for others.
Certainly.
So that's another really big ask, is to share, retweet, like all of the various kinds of information that you'll see throughout the month of February about Black women and heart health. And I guess the last ask.
There's no limit. Selena, you can ask away. There's no quota on the number of asks. Let's go. Yes.
I feel for time, so I'm just gonna
No, you're fine.
give for each and every person to know their heart health status. So start with yourself. I often say, we want to do for others, we want to help others, but start with yourself. We have a philosophy here at WomenHeart, because so many women only know how to take care of other people,
True.
don't know how to focus on themselves.
Yes.
I like very much the notion of what we often hear on airplanes when we fly, which is put your mask on first.
Yeah.
Help others, so that you can help other people.
Yes, ma'am.
That's really critical in heart health as well. Focus on yourself. Know what your risk is. Take care of yourself so that you can be here for others for the long haul. Stop there.
Wonderful, wonderful. No, those were not too many asks at all, and they're doable. They require some self-assessment, some outreach to others, some engagement around the topic of heart health, identifying, going to the website, following information, getting actively involved socially on social media with WomenHeart, as well as looking at the 34 states that WomenHeart does have presence, and then the 16 that don't, reaching out to some family and friends, that have experienced, being champions against heart disease and are, ready to take on a new chapter or find ways to engage. So no, those weren't bad. Those were really great asks, and I could see some great utility.
We are not just looking for champions in those other 16 states. So if you are in Novi, if you're in Detroit, if you
Yeah.
are in that, greater metro area of Detroit, and if you're ready and willing and excited about supporting other women who are going through their heart disease journey, and you're ready to serve, then come on to WomenHeart.org and we can sign you up to be a champion.
Wonderful. So no limit on the number of champions at all. This is good. Very good. Selena, so 2024 will mark the 25th anniversary of Women Heart. So as we round out this particular episode, where do you see the organization in the next couple of years as you approach the 25th anniversary?
It is a fantastic question, Naya. Thank you for that question. We have some big aims. We just launched a new strategic plan this year. It's a 3-year plan that will end actually on our 25th anniversary in 2024.
Yes.
And one of our big goals is to increase our reach. And, I want to put it out there that what we want to do is we want to reach 1 million women by 2024. We want 1 million women to be aware of their risks, be aware that they have support if they need it, and be aware that there are good sources of information and their ability to access cardiologists.
Yes.
We talked about this earlier.
Yeah.
Who are knowledgeable, and not only knowledgeable, but are focused on improving the experience of women living with or at risk of heart disease.
Absolutely.
So you can find those women, those superstars of cardiologists at WomenHeart.org.
Wonderful, wonderful. Selena, I do hope and pray that that vision will be realized. Do know that American Advantage Home Care and the Home Health Care Today show will do as much as humanly possible, right, to assist in fulfilling that vision of reaching 1 million women, to get them to know their risk factors, know that Women Heart exists, and of course, for them to reach out to other women. So I like the exponentiation of 1 million that tell 2 apiece, that tell 5 apiece, and then we have the entire country covered. Yes. So thank you so much for your time today. You've been extremely generous. And we'll have a couple of more episodes this month that are focused and centered around heart health. But thank you so much for kicking off the first episode this month, focused on such a very important topic. Selena, we will be in touch. Thank you.
It was great fun. Thank you.
My pleasure. Thank you, Selena.